Health Watch now, health officials are calling the rising number of kids using e-cigarettes an epidemic across the country. A preliminary survey by the University of Nevada shows a similar trend right here in Nevada. Brian Hoffman spoke with health officials and joins us here in the studio. Brian, first tell us about the survey.
Well, it's good news, bad news type of situation there, Ryan. The good news is that we've seen a decrease in the amount of kids who try out cigarettes, but the number of younger kids who've tried vaping, that's gone up.
Rates of e-cigarette use, vaping products continue to be pretty level at the high school level, but we see at the middle school level even more kids are using those products.
The preliminary report from the Nevada Youth Risk Behavior Survey shows the percentage of high school students who have tried e-cigarettes has stayed about the same, going from 43 to 44%. But for middle school students, it grew from 19 to 23%. Officials attribute this to the different flavors of e-juice, saying that they're geared more towards children. They say kids are also more easily able to hide their vaping habits from their parents.
They're making them into all kinds of different stuff. They're actually clothing that you can buy with it manufactured in. All they do is pull a little tube out of the collar and give it a puff. Kids are doing all kinds of stuff to hide it and be able to do it at school.
And for parents, there are a few warning signs to look out for if you think your child is vaping.
Unusual behaviors such as irritability, sleeping patterns changing. Those can be some withdrawal symptoms from nicotine use. And then also any odd gadgets around the house.
Those gadgets could look similar to a keychain or even a USB drive, like the Juul style of vape pen. And it's not just nicotine in these devices. The survey found that high schoolers that have tried marijuana by vaporizing it, 2% in 2017, up to 14% in 2019. And for middle school students, it went from 2% up to 11%. Now, if you are a parent with a child who may be vaping or using marijuana, the first thing that officials suggest is to open up a line of communication.
You know, we all know this is a hard thing to stop doing. Quitting any behavior and making change is hard for all of us. I would really encourage open and honesty in that conversation and open up to your child.
When a teen has been using these products, it may be that they are addicted, and there are resources out there for teens to stop.
For more information and a link to resources for parents and for teens who want to quit smoking or vaping, you can check out the online version of the story at ktvn.com. Covering Health Watch live in the studio, Brian Hoffman, 2 News.